This is the model of a lymph node. Lymph node is a small encapsulated structure in the pathway of lymphatic. The outermost lining, this one in black color, black wire, it denotes the capsule, and thereafter this lining up to inside, these are the inner substance of the lymph node, and this is the capsule which is interrupted via the afferent lymphatics. These are the afferent lymphatics. There are many afferent lymphatic through which the lymph come into the lymph node, and only one efferent lymphatic here, this one, only one efferent lymphatic through which the lymph goes out of the lymph node. This afferent lymphatic is coming on the convex surface of a lymph node, whereas the efferent lymphatic through which the lymph exit out is on the concave surface of a lymph node or hilum. Hilum is that structure, that part of an organ through which the blood vessel or the neurovascular structure entering inside. So this is the hilum where the concave surface is situated. Okay, now there is a space in between the capsule and the inner substance. This is space, this is called sinus, which is very much characteristic of a lymph node. Now what is lymph? One thing, there is a valve in the afferent lymphatic pathway as well as the efferent one-way valve. Only this valve can open when lymph enter, and only open when lymph exit out from the lymph node. Now what is lymph? In every organ, the oxygenated blood coming from the artery, the blood circulation is like this, that the oxygenated blood from the left ventricle is coming from the large artery, then to a small artery, then arteriole, then capillaries, then venule, then a small vein, large vein, and draining into the right atrium, then right ventricle, from right ventricle through pulmonary artery going to the lung for oxygenation, and then oxygenated blood coming from the lung to the left atrium and then going to the left ventricle. This is the whole pathway of the blood circulation, where the lymphatic circulation exists. When the arteriole or small artery enter into an organ, into a in the any tissue or any cell, okay, at cellular level, when the small arteriole enter and give branches, that is the capillaries, which is the fenestrated wall, which has got fenestrated wall. The blood is carrying nutrition for the cell, and after giving nutrition, it again take out the excreta from the cell, and then it is going through the venule. But the fluid, or you can say blood, which is coming out of the capillary through its fenestrated wall, that much amount of fluid or blood is not coming into the capillary and then venule, not coming that much amount. Some amount of fluid remain in the tissue and the cell as the cellular fluid or tissue fluid. That fluid is called lymph. That fluid is called lymph, And then this lymph, as it is of the fat globules which lies in the lymph is of very much big size, so that it cannot return back into the capillaries. So this now they will enter into the lymph node through the lymph node through the afferent lymphatic. Okay, and now what is the lymphatic circulation inside the lymph node? They are coming via the afferent lymphatic, then this portion up to this one only, this one that lies on the periphery, this is the subcapsular sinus. That space that lies just beneath the capsule is the subcapsular sinus. And now these are the trabeculae. Trabeculae, when the capsule, the lining of capsule penetrate the substance, this is called trabeculae. And this does septation of the lymph node, but incomplete septation, not coming up to the medulla. What is medulla I will discuss later on. This is the subcapsular sinus, and the space around the trabecula, this is trabecular sinus, and now they are coming into the medullary sinus and then now exit out through the efferent lymphatic. So these are the lymphatic circulation inside the lymph node. Okay, now the inner substance of a lymph node is divided from outside to inward, or from convex surface to the concave surface. It is the cortical area which is shown in this yellow color. This is paracortical or inner cortical. This is outer cortical area in yellow color, which is characterized by the presence of B cell. And this is the inner cortical area or paracortical area, which is characterized by the presence of T cell. And this one is the medullary area in pink color. These are which is characterized by the presence of P cell or plasma cell. Okay, and this is as every organ has got its blood flow inside for the nutrition. This lymph node has also got this this is the small artery up to the medullary region, and then this is arteriole in the inner cortical region, and then outer cortical region, these are the capillaries, and again in the inner cortical region these are the venules, post capillary venules, and these are the small veins in the medullary region. Okay, one thing very much special to the lymph node, that in the area post capillary venule, this is the capillary and this is the venule, post capillary venule. When we enlarge this area, what we are seeing, as all the blood vessel has got flattened squamous epithelial lining inside, but at this region only, in the post capillary venule, this become modified and become tall columnar. Okay, and having a receptor on its luminal surface, and this is called the homing in receptor. Its task is to just pick up the vagabond lymphocyte which is traveling within the blood circulation. It just pick up that vagabond lymphocyte and put their put that lymphocyte into their own areas. That if that is B lymphocyte, then it this columnar cell put that lymphocyte in the outer cortical area. If that vagabond lymphocyte is of T type, then it put that in the inner cortical area, and if the lymphocyte is plasma cell, then it put into the medullary area. So these are the homing in receptor which is only found in the post-capillary venule. Now, what is this MAF? These are the cells which is found everywhere in outer cortical area, inner cortical area, and the medullary area. What are these? These are one in green color and brown color. This green, these are the both are A cell, that is the antigen presenting cell. This is, and this brown one is the architecture making cell. The antigen presenting cell, these are three in type, that is MAF, the macrophage, antigen presenting cell, and the follicular presenting cell. These are, we all know lymph node is the part of the immune system. So जब किसी जो बाहर से अटैक करते हैं, जो उनको पकड़ा जाता है, तो उसे तीन प्रकार का ट्रीटमेंट होता है. एक तो उसे मार दिया जाता है, या नहीं तो फिर दो तरह के सैनिक होते हैं हम लोग के पास. एक तो मेनली उनका काम होता है कि मार दो, और दूसरा होता है कि एक बंदी बना लेते हैं और सबको दिखाते हैं कि देखो ये हम मेरे ऊपर अटैक कर रहा है, जल्दी से तैयारी करो, ये दिखाते हैं. और फॉलिकुलर प्रेजेंटिंग सेल ये बंदी बना लेते हैं और सालों साल से बंदी बना के रखते हैं. ये सबको दिखाते नहीं है, एक जगह छुपा के बंदी बना के इसे पकड़े हुए रहते हैं सालों साल, for decades. Okay, so these are three types, that is the macrophage, the main action of which is phagocytosis. This is antigen presenting cell, which the main action of which they present the antigen to every immune cells. And this is follicular presenting cell. Follicular presenting cell is only found in this outer cortical area. Okay, it is very much characteristic of that area only, and it hold the antigen, not present antigen to everyone. It only hold antigen for decades. Okay, and this is architecture making cell, and this is of two type, reticulocyte and the fibroblast. Okay, now this macrophage has got a sword inside, what we are seeing in red color. This is lysosome. Lysosome जैसे तलवार पागल होता है मारने के लिए, किसी दूसरे को मारने के लिए, वैसे ही दिस इज, इट कंटेन्स मैड स्वॉर्ड. मैड मीन्स M for myeloperoxidase, A for acid hydrolase, and D for defensin. वो अपना तलवार से आप अपना बचाव भी कर सकते हो, डिफेंस कर सकते हो. एसिड हाइड्रोलेज, एसिड अटैक मीन्स अटैक भी कर सकते हो, बचा भी सकते हो. माइलोपेरोक्सिडेज, दिखा के दूसरे का दिमाग भी खा सकते हो, माइलोपेरोक्सिडेज. ओके, सो दिस the lysosome present in the macrophage does the reaction by these ways. Okay, so this is about the cells. And now this is the B cell, which get activated in the presence of antigen presenting cell. Get activated, and in the center, this germinal center appear, and germinal center where the highly proliferation, the multiplying cells are there. The proliferation starts from the center, and that's why this is also known as centroblast. And this type of follicle is known as secondary follicle. Its size is large, and in the middle it is pale staining, because here it shows the open nucleus. Open nucleus, that is euchromatin, that is DNA, its chromosomes are open, ready to that's so the highly proliferative phase, euchromatin. Okay, and the plasma cells is very much characteristic of clock phase nucleus, in which the chromatins are pushed by the side, and they are deeply stained. So it gives the appearance of a clock. That's why the plasma cell is also known for its clock face nucleus. Okay, B cell give us the humoral immunity, whereas the T cell is known for the cell mediated immunity, and the plasma cell is nothing but the activated B cell which secrete the antibody. Okay, T cell is of two types, that is T helper cell and the T cytotoxic cell. T helper cell activate the B cell to produce the plasma cell and antibody, and the T cytotoxic cell is just destroy the antigen by cytotoxic nature, by secreting the cytotoxic substance. Now, what happens in if there is hyper or hypoproliferation of these cells? The hyperproliferation of B cell occur in bacterial infection. B for B cell and B for bacterial infection as well as Bruton's disease. In hyperproliferation, in which case hyperproliferation of B cell occur, it is the bacterial infection, and in which case hypoproliferation, that is the suppression of B cells occur in case of Bruton's disease, Brouton apostrophe S, Bruton's disease, or also known as A gamma globulinemia, in which the B cell get deactivated, and it is a X-linked disease and found in the male child. Okay, and in which case T cell hyperproliferation occur uh, in you can say the mnemonic is fever, that is the fungal infection, and the intracellular infection, and the FIV, P for viral infection, FIV fever. Okay, and when it get depressed, जब वो ठंडा हो जाएगा तो depressed, that is TD, dGeorge syndrome. T cell get deactivated in dGeorge syndrome, which is a clinical syndrome in which there is non-development of third and fourth pharyngeal pouch due to the non-proliferation of third pharyngeal pouch, and there is third pharyngeal pouch non-development will lead to hypoparathyroidism, whereas the fourth pharyngeal pouch will lead to the the non-proliferation of T cell. Okay, and that is called the dGeorge syndrome, and in which case the plasma cell hyperproliferation occur, and the hypoproliferation, it is same as that of the B cell. And now in which case both B and T cell inactivation occur, that condition is known as SCID, that is the severe combined immunodeficiency syndrome, in which there is a loss of both humoral as well as the cell mediated immunity, and the patient will suffer both type of immune losses and lead to the death due to the severe infection. And one case is the adenosine deaminase deficiency, ADD, in which the adenosine deaminase means deamination of adenosine do not occur, due to which there is many adenosine is there, accumulation of adenosine, that will lead to the loss of immune function. But here a breakthrough occur done by the scientist, in which the one virus which is supplemented with an enzyme, and that is adenosine deaminase. That enzyme is incorporated within the virus cell, and then virus is injected in the patient, and that virus is very much fond of lymphocyte, to eat lymphocyte. So that the injected virus go to everywhere where the lymphocyte reside, to each and every places, and then they spill out that enzyme over there, and there is a dramatic improvement in that case. Okay, so that is the the adenosine deaminase deficiency. So these are all about the lymph node histology. Thank you.